Hello everyone, welcome to my channel Creativity and Mindfulness with Subhamita. So today is 10th October 2021 and happens to be the World's Mental Health Day. What is Mental Health Day? Probably few of us know, and mostly we do not know, and we are not aware of this day even, because there are several days nowadays celebrated for some special events. So we hardly remember the ones we actually need to remember. So just a brief introduction to World's Mental Health Day. It was first initiated in 1992, and after a successful happening for 2 years, in 1994, World Health Organization took the charge of it and called it for the repetition in each year with a theme. And this year in 2021, the theme is mental health care for all. And so let's make it a reality. So this World's Mental Health Day, this is actually an awareness program. So all the people who are related to mental health programs, maybe the clinicians, maybe the practitioners, or maybe the researchers, all try to generate the awareness through this platform today that mental health is very necessary for a healthy life. And once we talk about mental health, we primarily think that mental health means we are going to discuss about the illnesses. Yeah, of course, when we talk about health, of course, we talk about the illness as we talk about dark and light, right? Because when we talk about light, we appreciate light because there is darkness. And in the same way, we can feel the dark when there is no light. So of course, mental health means a healthy mind, but we also need to know when the mind or when we are not feeling healthy, and when we should think of it seriously, and how we can make ourselves healthy by mind and by body just by routinizing ourselves. Sometimes we need to consult clinicians, but not always. So as we all know that lifestyle diseases are some diseases that we can control by ourselves, just regulating certain things in our life. So mental health is also like that. So if we can practice certain things, some mental exercises, then we can be mentally healthy as well. So today I will start our discussion with three persons from three different platforms of mental health workers. So first I will talk about the senior neurologist, Professor Dr. Tapan Kumar বিশ্বাস from RG Kar Medical College and Hospital. He has been there for entire his career, and now he is the next head of the department of that medical college, and he practices regularly. He is a senior clinical neurologist. So we have him as a neurological consultant. We have Dr. Rudra Prasad Acharya, who is a clinical tutor and consultant in psychiatry department, Calcutta Medical College. He was also an senior resident of psychiatry and NDDTC, AIMS, New Delhi. So we are having a psychiatrist for the psychiatric consultation, and we have a researcher who is a postdoctoral fellow in Center for Human Genetics and Genomics, NYO, School of Medicine, USA. She is Dr. Tista Noshkar. She has pursued her PhD from NBSc and has been awarded by University of Calcutta. Now she is in USA as a postdoctoral fellow. So she has mainly worked on complex diseases, mainly neurodevelopmental disorder, which is dyslexia. She has extensively worked in dyslexia from NBRC, and now she's in USA, and she's working with single cell RNA sequencing, GWAS, and all these things for different complex diseases, and also for some enteric nervous system diseases. So basically what we are going to listen from her is the key points of advancement in the neuroscience research, And we are going to make it an interactive session so that we all can share our views. And we will try to make the session as simple as possible for you to understand. But please stay tuned. I think it will be a definitely good takeaway message for you. Stay tuned. So today, when we discuss about mental health, we will do it in a very different way. We will try to portray mental health as a reaction to your brain biology. Because when we talk about mental health, there are various perspectives on it. There is the perspective of human behavior, there is the perspective of psychological theories. There are also some philosophical theories related to your mind and mind-body coordination. And there is the biology, which talk about the basis of the disorder. So, and also, of course, when we talk about mental health, there is a big issue of human rights as well. So, when we try to portray mental health here, we will first, our first objective will be to looking into the biological perspective, as we do it for the other diseases. Like when we talk about some disease like diabetes or hypertension or something, we first focus on its bodily part, on its biology, and then we talk about other things. So in the same way, today we will do the same thing for mental health. So if we talk in that way, so first, mental health is a term that is related to your behavior, how you behave, how you act. You may be a toddler or you may be a senior citizen, but how you act to your surrounding, how you do your work, how you interact with your society. This all things are a part of your behavior. And this behavior, if you come to the very deep-rooted theory behind this behavior. So when we do anything, either there is a goal, that means we want to achieve something, that's why we do something, or we inhibit ourselves from doing something because we don't want to do that. So it is always what we want and what we do not want, and that drives our behavior. Now, if I talk about this thing in a very biological way, there is a very famous theory, which is biophysiological theory of human behavior, and that was postulated by Grace long back, which calls a behavioral activation system and inhibitory system, which says actually the same thing that I told, that when you have a goal, when you know what you want to do, then you do certain things. And when you don't know like whether you should do it or you shouldn't do it, or is it good for you, then you have some certain kind of resistance, and then you try not to do it, you restrict yourself. Or if you know that there is something negative impact, like something bad will happen to you, you feel nervous, you feel tense. And if you very deeply think about it, you will understand that how you behave, whether you are too excited to do something or whether you are too lethargic to do something, actually drives your behavior. And if you have this balance well, like you know when to behave positively and when to restrict yourself, probably you are at a better position to handle your situations. And if not, there is some problem. And if we talk about the diseases or the discomforts in the perspective of mental health, we will see that most of the mental health problems are related to somehow this kind of decision-making things. So first I will come to Dr. Acharya, that as I mentioned, that behavior is a kind of balance between your activation and inhibition. So can you just explain that in a very simplistic way when you talk to your patient, or when a person comes to you with a complaint of discomfort, do you find that this is a primary thing that gets affected, like people do not know what to do, there is an indecision problem, they often take some drastic decision, which sometimes later they think, no, it is perhaps they have taken the wrong decision or they don't understand it. So do you think that this is the primary lookout for a mental health professional to know that where is the problem in this system? Yeah, Dr. Acharya.
Thank you for giving me the opportunity to interact. So the question you have put right now is very important. See, mental health, as you have already, it has many facets. Okay. So previously, if we go through the history of mental health and mental illness, previously in the beginning of the psychiatry or the mental health, we used to focus on the illness perspective on, and with every passing day, especially now, each time we are focusing more on mental health. Okay, mental health. So the focus has actually shifted from curing the ill to promoting positive psychology. Okay, so if we think about different facets of mental health, as you have told already, that decision making is very important, or I would say the cornerstone of each and every psychiatric illness. If we put aside mental health for some time, if we consider only the aspect of illness, say for example, if you know about different psychiatric illnesses like depression, anxiety, obsessive compulsive disorder, each of them carry with it a different challenge of decision making. Say for example, if it is obsessive compulsive disorder, as we know, the person makes a decision, checks it again and again, and even after doing that, he or she keeps doubting it. So he or she cannot actually end up deciding whether he is doing the right thing or not. That is one. If we consider depression, there is a difficulty, there is actually a lack of initiative in taking decisions. I will not take some decision, I lack the initiative of taking decisions. Okay. And if we consider anxiety, there is a fear that the decision I am taking, or the judgment, my judgment, the judgment I am taking, whether it will have a negative or painful impact on me, and therefore I try to avoid that decision. Now, if we look into it from a neurobiological, if I consider another disorder, that is bipolar disorder, which has two phases, say for example, manic phase and depressive phase. In manic phase, again, this decision-making capacity, as you have already told, that there are two different systems like behavioral activation or approach system and behavioral inhibition. So in this three previous, in which all the three which I have told already, that depression, anxiety, or obsessive compulsive disorder, the inhibitory system takes the upper hand in most of the types. But if we consider say manic episode or manic episode, hypomanic episode, and in some cases ADHD, which is a very commonly diagnosed illness in children, lack of inhibition takes the upper hand, and therefore at that stages, especially in manic phase or during the course of ADHD, the person takes decisions which later he or she, when he comes down into a normal state, he actually regrets that why I have taken the decision, and this decision, which is born out of impulsivity, may have negative consequences on the mental health as well as long-term physical health, which is very important. For example, if I am in manic phase, I take impulsive decision like I spend a lot of money or I do something, some rash accidents. So that obviously becomes a bit painful for me. And if we consider personality disorders, in many personality disorders, there is an inherent impulsivity.
So let me bring it to the other part of the story. So now Dr. Acharya has talked about the diseases, or I will not say diseases, the challenges mostly prevalent in terms of clinical diagnosis. But there are certain persons who do not meet all these criteria for behaving in a particular group. Or if I talk about the day-to-day behavior, which is we say as normal, which is we say as the most frequent behaviors. Let's say today I have to go to a market to have something and it will rain. So now I have to think, should I go to market today or should I postpone it? Because going to market to bring something for my own is a kind of approaching behavior with a positive stimulus that I'm picking up something new, so that is a signal for my positive survival. But I know today it will rain much, so I may get wet, I may get cold, and I may have some problems later on. So there is the condition that needs to be considered, whether to activate or whether to go towards this behavior. Now, on the contrary, when I have this conflict within me, I have to think that whether it is very important to go today or I can postpone it to tomorrow. So that is another level of thought process that I need to take. So now what Dr. Acharya has talked about, let's say depression, anxiety, ADHD, all these problems, they have this kind of decision-making problem, but in a different order. But in the general people as well, we sometimes face from this problem. And this is where I want to come, that when these systems we talk about, these are very well present in everyone's behavior, and it's deep rooted to our brain circuits. Like there are different parts of the brain that can get activated when we think that there is something rewarding for us. Like I will pick up something that will give me pleasure. So that is a different part of the brain that will send this kind of signal to us. And there is another part of the brain which will say, no, don't do this, because this is, if you do this, you will get a punishment. So this is always rooted to our biology. Now, if I talk about these diseases in a general
Shubhamita, can I just cut you a little bit?
Yeah, sure.
So yeah, I just thought one thing just came in my mind. First, thank you so much, Dr. Acharya, to share the real life experience with us, definitely. And one thing, Shubhamita, it's not always, as per I have seen, that it's not always that the one part of the brain activates or deactivates. It's a multiple part and the connection of the
exactly. I was just coming to that.
It's not the full.
It's not the left and right part of the brain. I was just coming to that part. I started with one part of the brain because it's easy for a person to understand. Because if I start with a circuit, so that may be an uncommon term for a person.
Definitely.
Yeah. So that's what I was trying to say, that there are some different regions of the brain that get excited or that get inhibited for doing certain works. So when there is a general normal behavior which is not related to the diagnostic behavior in any way, that also has the same mechanism of activation or inhibition.
True.
So now my question to Dr. Acharya is that, since this is a very common mechanism that we all have and we all execute our behavior with that through that common mechanisms, so how does this once lead to the diseases?
Let me take a cue from the most relevant research which is going on as per me, which is the RDoc, research domain tracking. Okay, so with the RDoc, we have tried to take I would say a downside or upside approach from the behavior back to the cells or the molecules, or from cells back to the behavior. The thing is that though the symptomatologies, they seem quite common in the, say, depression, anxiety, or obsessive compulsive disorders. Symptomatologies may be common, but the circuitries that they are involved, they are not entirely the same. Okay, they if I take an example of a thermostat, okay, we have learned about thermostat in our previous in our school days, or if I take an example of a switch. Okay, so there are different switches in a circuit. Okay, so if I switch on at one point, at other point it may get switched off or switched on. Let me give an example.
Dr. Acharya, your phone is muted.
I am muted. Sorry. Can you hear me right now?
Yeah.
Yes.
So you have to start from. Let me take an example. After that. Hello. He's freezing.
Yeah, I
Hello.
think
Hello?
there is some connection problem.
Yeah. So
Can you hear me?
Yes,
Okay.
now we can
I
hear
think
you. So
actually
you have
call
to
came.
continue from. We just heard till. Let me give an example. So you have to continue from the
Okay.
example.
That's the plot actually. Okay. You told about dopaminergic pathway. Okay. So dopaminergic pathway is the key. Dopamine is the key neurotransmitter in the reward pathway. Okay. So as we know, dopamine stimulates us for a reward cue. Either I expect a reward or I feel a reward. Both in both ways, dopamine can act. But there are other neurotransmitters in other circuits which can actually inhibit this dopamine surge. Glutamate is I mean GABA. GABA is one of the inhibitory neurotransmitters, and there is another excitatory neurotransmitter which is glutamate. So they actually interact amongst themselves in such a way in a circuit that at times GABA or the inhibitory ones get the upper hand, and at times glutamate, the excitatory one, that gets upper hand. So this circuit, they are not same in every individuals. Okay, and they differ. They differ how? Due to the gene, and later due to the environment, which we know as epigenetics. Okay, so the genetic vulnerability is there for a people, for a group of people who have some genetic vulnerability, and above that, if there is the effect of epigenetics, that vulnerability becomes a phenotype. So in that way, the symptoms are. Can you hear me?
Yeah, I can hear you.
Okay, in that way, the symptoms are manifested. So it's like a spectrum. Okay, we all fit in some part of the spectrum. Okay, say for example, if it's a psychotic spectrum disorder, there will be a person who will fit at one end of the spectrum and will be manifested as schizophrenia, and there will be some people who will not fit into the criteria of schizophrenia, but they might be having some traits of psychosis. Okay, which may be dominated by negative valence, psychoticism, and if we go through the construct of personality disorder. So the manifestation is
Different.
hello.
Yeah.
Is there
So
any...
you want to say manifestation is different, right?
Manifestation may be different. Say, for example, if we consider depression, anxiety, and obsessive compulsive disorder, they have some commonalities between them. But the thing is, the circuits have some difference between them. Okay, they are not entirely common. Okay, they share some common phenotypes, but if we try to deconstruct them, then they are not completely same in the root. Okay.
Means
So
you mean
genes,
to say the balancing between the different circuitry system is vary from individual to individual, and that
yeah,
manifests the disease.
well,
And you
yeah,
are now you have brought a fantastic point of view of epigenetic regulation of
Yeah.
those.
So before I go to
yeah,
that, I think I need to translate it in a very simple language. Otherwise, my viewers will
yeah,
not understand all the part of it. So what
yeah,
Dr. Acharya wanted to mean is that, so I talked about dopamine and he introduced two other terms. So dopamine is a neurotransmitter. It's a chemical. As you have different chemical in your blood, it's maybe hemoglobin, maybe something else. So this is also a chemical which is mostly prevalent in brain, but it is also prevalent in other different various organs. Dopamine is very much involved in our muscle movements. In various forms, it is more involved in other things. So what Dr. Acharya wanted to say from my statement is that I mentioned about one particular chemical and one particular circuitry, but he wanted to say that it is not only one which is like the king of the kingdom. So there are different
yeah.
circuitries.
One thing, I want to say one thing. Even if we consider dopamine, okay, even the dopamine is distributed amongst, as we know, 5 different circuits,
Exactly.
at least
Yes,
5 different circuits, and
yes.
their interaction are very complex.
Yes.
Okay, that's
And yeah, and that also, like, there is I talked about one system, one circuit. So Dr. Acharya already told that it is not only one system, it has 5 branches. So even these 5 branches are connected to other 5 or other 25 branches, and in this way this is all about the meshing network in the brain. And when this meshing network, it behaves together, then as he mentioned that some certain light is switched on and certain light is switched off, and so we get a resultant light from the brain, which is our behavior. And now what he talked about glutamate and GABA, so those are other neurochemicals which are actually like in the down process of dopamine. When dopamine gives some instruction, not only dopamine, there is dopamine, serotonin, noradrenaline. These are all like mediator neurotransmitter who give the instruction that you do this. And then there are this glutamate, GABA and other things that execute that. So even what I give you, that person as an instruction, and what I give another person as an instruction, and then they do coordinate among themselves, so that becomes different. So in that way, in the brain, that is different. The circuits are different in any way. If you talk about the rainbow, which goes from violet to red, so there are different shades. And if you just tone down and tone up some of the shades, the color of the visual will be different. It's not white always. So in the same way, the brain also behaves like that. And he very well introduced the term epigenetics, which is actually, without mentioning what, we cannot talk about mental health, because epigenetics is, in a very simple term, is how the environment influence our genes, and that gets reflected in our behavior. So that is epigenetics. That also Pista was mentioning about, that epigenetics is so important. But my question now is a little different. That I wanted to ask in the previous question, that we all have this circuitries, we all have these complications, we all have different genetic makeups in some way. But certain people get the diseases, certain people do not get the diseases, but we all are very vulnerable to it. Like with any environmental insult or anything within our brain that changes, we can get the same symptoms as a clinically diagnosed patient has, right? So what I want to know from you is that how vulnerable are all of us for getting any psychiatric diseases?
say Thalassemia major, which is very prevalent back in India, as we know, it's due to genetic interaction. If we try to keep it simple, that it's genetic interaction between the parents and which unfortunately gives rise to the thalassemia major in the offspring. But in spite of that, there will be children who will not get thalassemia, even the parents, both of them are carrier of thalassemia. There is a chance that the child born may not get thalassemia. So if there are two children, two siblings, one is getting thalassemia and another is not, do one sibling ostracize the other one? Do they? That, oh, okay, you have thalassemia, and I do the sibling, other sibling discriminates that other sibling who is having thalassemia? They do not. Both of them may be having vulnerabilities, but one had philanthropical expression, one do not have. So that does not mean that the person who is not having thalassemia will discriminate or mock the other. Similarly, many of us, if we do a genetic study throughout the population, many of us would be having some kind of genetic vulnerabilities of developing mental illness. If we try to decode mental illness, if we try to deconstruct mental illness, ultimately somewhere it will come back to the cellular level. So I am fortunate enough right now at this point of time, I am talking about cross-sectionality. Cross-sectionally right now, I do not have phenotypical expression of any mental illness. Does not mean that in future I will not have similar expression.
Exactly. This is very important, that at this present moment, probably we are not diagnosed with a certain type of diseases, but that doesn't mean that we will not have. And even just Dr. Acharya, I just add into it, when even we talk about these problems and these diseases, each of them, if we partition, so there are certain traits which go up and down. So even in our general population, even if you see, some has, let's say 10, if there are 10 traits, so for getting that big diagnosis, you need to have the 7 of that 10. But if you go to our general population, you will find that people will have 1 or 2 traits which are actually high, but that is high, but that is not giving you any problem. So you are feeling safe, or we are feeling safe, but we too have some traits which are marking high or low with respect to the normal. So yes, you're right, we are always vulnerable to this one, right? So what do you think that this kind of awareness, that we always can have this kind of diseases, or this should be taken as an awareness, or we should get prepared in some other way, like
I think the mental health awareness program should serve two basic purposes. One is to understand that no one is per se immune to mental illness. And number two, if somebody gets mental illness, it is not a vice to get mental illness. It's just like other physical illness. So one part would be to be careful about our own mental health, to be protective about our own mental health, to be preventive about our own mental health. That is one part. Another is not to stigmatize those who are having mental health issues. Okay, because you know the coin may flip very easily.
exactly. Very, very, very well said. Yeah, exactly.
So the thing is that
yeah, please.
Regarding destigmatization, we'll have to go, I mean, much more kilometers. But regarding the prevention of our own mental health issues, I would say that there are very basic things we can try to maintain. One thing, there are certain vulnerabilities which we cannot change, just like age, just like gender, we cannot change them, but there are things
Exactly.
which
And
we can
with this
change.
age, we will come to this point again, but with this age, I want to ask Professor Dr. Bishash, who is the senior most here and who has the experience of years with dealing the patients. So, sir, what do you think that as we talked about this kind of mental health issues, which is with the very basic of it, that activation, and then we talked about decision making. Now, Dr. Acharya. So these things, how does the progress of this thing change with age? Because the age is already a vulnerable factor. With age, there is different kind of changes within the brain circuitry, and within the cell itself. So cells get degenerated within the brain. When one cell meets to the other cell, there is a meeting point we call synapse that gets degraded. And there are various changes that take place just due to age itself, including higher mortality to neuro infection, sodium potassium imbalance, and all these things. So when age is a hit point, how does this mental health change during that time? And what is your experience about that?
There are some things a person has got some innate tendency to develop something which we will never be able to unravel. So this is a common thing. For example, even a person had no family history and he is having this sort of mental illness. And we have seen that this is just a sporadic case, no hereditary problem. This is the thing. And why that person is developing this? Perhaps his neurotransmitters, they are also not in balance. So that sort of, for example, Huntington's disease, mostly it is hereditary, but sometimes it is sporadic. What that sporadic means? His brain, since birth, has got some sort of imbalance, resulting in development of some above the other, this neurotransmitter mechanism, so that with age, he will develop this. These are the sporadic cases. But hereditary cases, we know that because of this gene, he will develop this. But in sporadic cases, this is the thing, that since birth, he is having some sort of imbalance which we do not know, which will be manifested later when there will be relative deficiency of the neurotransmitters. And regarding aging, now with aging, what we get, there is definitely senescence of the neurons. There is definitely lack of neurotransmitter synthesis. There is definitely lack of neurotransmitter transport via the axon flow to the terminal buttons. And there is a delay in transmission of impulses from cell to cell. All
this
these
happens to everyone, right, sir? This is,
yes.
You are talking about aging in general. Like whoever is aging, he or she will have these things, these processes going into their brain. Yes, sir. Please continue.
And the thing is this, that this sort of the affection of the neurons with aging will also vary. And that is why many cases of this Huntington's disease or even Parkinsonism, a patient without any genetic history of Parkinsonism has developed Parkinsonism with age.
With genetic history, you want to mean that there is no reported relative who has been affected, right? You want to mean that? Okay.
Again,
yes, sir.
Correct. I mean,
yes,
so again, yes. So what happens? There is this imbalance was there in the early part of the person, but later what happens? Due to lack of proper neurotransmitter interaction and proper neurotransmitter synthesis, this is manifested later. It was there, but to be manifested later because of lack of this sort of interaction, neurotransmitter interaction, and so on. So this is the basis of defect in our neurotransmitter system with age, or neuronal activity. See, with age, what happens? The reaction time, the reflexes, the ideation, etc., all are delayed because of this.
Yes. Yes.
And you will also see that with age, there is a chance of forgetfulness, not in the early stage.
Exactly.
Usually, why there is chance of forgetfulness? Because of this degeneration that we may discuss later. But this is about the aging. With age, the imbalance in neurotransmitters due to damage and inactivation of the cells, of the neurons,
Yes,
we
sir.
encounter.
With that, if you kindly, say something about the Alzheimer's or dementia, means what is your experience?
As he mentioned already about the forgetfulness, and
Yes,
I
that's
think
why I was thinking.
everyone knows about Alzheimer's. If they don't know any other thing, but they know Alzheimer's
Yes.
because it is so highlighted today in the world.
Right.
And actually, it needs the highlight because it's really growing faster. So, yes, sir, please mention something about your experience with dealing Alzheimer's patients, a person who is suffering from Alzheimer's, and if you have a long time experience that you started treating him from the day one and he continued with you. So how will you talk about the progress of that phase of Alzheimer's?
In fact, what in common we encounter is that if one has a manifestation of this forgetfulness for common things, we pinpoint him having Alzheimer. No, this is not the thing. Alzheimer's is a sort of dementia. And what is dementia? Is amnesia plus lack of this cognitive function, normal cognitive.
Please also say what is amnesia for my viewers.
Amnesia is plain and simple forgetfulness. This plain and simple forgetfulness, when coupled with lack of social adjustment for day-to-day activity, it is called dementia. This is in a nutshell.
I just add, like, if you have a forgetfulness, that means if you are forgetting much, and this forgetfulness much happens to the episodic memories, and the recent memories. Is it so, sir? If I'm not wrong, it is more related to the recent memories because the neurons which are, because in the deep root in Alzheimer's, the neurons, they don't get the long-term potentiation. So the recent memories and more related to the episodic memories, like a person has just left his house and then he forgets how to come back to the house, or a person just forgets how to take the water. In the even advanced stage, the person just forgets how to take a cup of tea and how to do it. So this is a procedural or episodic, that is much more affected, right, sir?
Yes.
And with that logical sense and like self-regulation, this also go down, right, sir?
Yes.
Yeah.
Actually, what happens is that the first sort of memory impaired is the recent memory. The recent memory is impaired and also including the episodic. So what he learned just now is forgotten. So this is due to lesion in the hippocampus and other parts of the diencephalon. And this is the initial stage of this Alzheimer. The remote memory goes last, and it is much more impressed in our brain.
That's why people can.
Remote memory starts fading. The remote memory the patient will develop social misadjustment. The patient will develop features of social problems. That is a fairly moderate to advanced case.
So,
And
so
sir,
sorry,
yeah.
please you continue.
No, you say.
So I was just wondering if sir can, give some messages to the others that when one person is feeling or getting a feel that he has started or he or she is starting the forgetfulness, then
Yes.
should they start thinking of taking the actual help, maybe the professional help, or what is your message, or how do you think that Alzheimer's or dementia can be treated, or at what stage of that they should go to the doctors or take some professional help? So
Yeah,
that I
in
would like to know.
addition to this study's comment, actually you have just told what I wanted to say. Thank you. In addition to that, I just ask you, sir, that there are also few reports where a person when starts having this forgetfulness and little bit of cognitive problems, that means deficiency in the higher order of mental functions, let's say judgments, let's say executive control and these things, that go down. But that go down up to a little bit. So if we take about the curve, it goes down a little bit and then it goes parallel. It doesn't go further down. So when it goes just a little down, it is clinically said as a mild cognitive impairment. And then
Yes.
it can be parallel, like it is not going down anymore. And if it goes further down, then the problem comes with whether it is Alzheimer's, whether it is frontotemporal. So I want to know how you can distinguish whether it is or how you diagnose whether it is sticking to the point and going parallel, or it is going down deep to be diagnosed with Alzheimer's or frontotemporal.
In fact, this MCI or this so-called minimal cognitive impairment, it lies between normal senile impairment of memory and true Alzheimer. So it lies in between these two. And the patient may remain, many of the cases do not deteriorate in that way. Some cases deteriorate and results in this frank Alzheimer, and many cases remain in that way for
That
fairly
parallel
long
line.
time.
Yes. So in that case, when a patient comes to you, like how do you prescribe or how do you treat? Like, can you predict that it will go further down or it will stick here? Or what are the symptoms that you understand, okay, it is going further down? So what are the parameters that go beyond MCI, beyond that minimal cognitive impairment? So
Yes.
how do you distinguish that? And is the treatment different? Like how you treat with the choline antico? Yeah.
Assessment of such patient is should be done at regular interval, as Dr. Acharya also knows better than me perhaps. And these assessments often point towards what the patient will develop. This is the assessment portion. And this follow-up is necessary for that at periodical interval, a few months, at least 1 to 2 times a year, and like that, depending upon the physician concerned. And also, one thing we must not forget is about the caregivers or the relatives. We must assess, we must tell them that this is a condition of your patient, and you will have to realize, you will have to encourage the patient without scolding him. Oh, what you are doing? You are making problems like this. No, the relatives and the caregivers should be
Compassionate.
Yes, so that the patient, you see, if such a patient with MCI becomes depressed because of this external stimuli, negative stimuli, this condition will gradually go down. And this amnesia plus depression, this depression continuously will enhance, has been found that this will enhance his downhill progress. And
so as Dr. Bisher sir has mentioned that the patients has to be visiting the doctors in a regular interval, which is a very very good time-taking message for us. That as a senior neurologist, Dr. Bisher sir is asking the patient and the patient parties that please consult the doctor in a regular interval, because whatever be the research which is going on, it has not still been translated exactly pinpointly to the clinical part of it, so that now we can predict that after MCI you are not going to get the deterioration, or you are going to. So you still have to continue the process, and the doctor has to know, the clinician has to know when you are deteriorating much or not. So it is completely a clinical perspective that a doctor has to say. So in that case also, sir, I would like to know one more thing, that there are certain physical problems, like in case of diabetic patients, in case of hypertensive patients, in case of extreme infections, this time the brain also gets some kind of insults. And this also happens more in the aging patients. So when a patient has a very long history of diabetes or long history of chronic kidney disorders, how likely are they to develop some neurological problems? And what do you suggest that with these things, should they consult also a neurologist in a particular interval, or they should come after they see the problems in them? Because you also know that neurodegeneration starts well in advance and the symptoms come later on. So what will you suggest the patients of this diabetes and infectious diseases, even the patients with asthmas? So they also have some tendencies to get neurodegeneration at the later half. So how will you say them to be safe from getting it at the time, to delay the onset rather? Yes, sir, up to you.
Yes, it is true. Infection is not that important like this metabolic and hypertensive parameters, hypertension, diabetic, hypothyroid, etc. And these things, they adversely affect two things. One is the vasculopathy, one is neuropathy. For example, diabetes, vasculopathy. Diabetic patients are more prone to develop vascular changes, vascular pathology in brain compared to a normal person. So, if we get a patient with these sorts of amnesia or even dementia, first and foremost thing we must ask diabetes and hypertension. These two things we must have. And also, we must not forget to inculcate in his mind, if he is a smoker, if he or she is a smoker, the drawbacks of smoking. You see, the three things we must not forget. One is diabetes, one is hypertension, another is smoking. And secondary things we must not forget is obesity, sedentary habits, and this and irregularity in day-to-day activity with age. These things enhance the formation of the pathological process which they encounter, like Parkinsonism, like AD. Whenever a patient with these manifestations, like Parkinsonism, like AD, often AD is mixed with Parkinsonism, as we get in this Pacific island of Guam, the Parkinsonism dementia complex, like this. So these things we must not forget that what is the predisposing factors. These predisposing factors, hypertension, diabetes, smoking, and other habits that results in damage to the blood vessels and damage to the brain parenchyma must be assessed.
So since we have traversed from many of the biological perspectives, and we tried to focus on the research as well, as simply as possible. So I will request this study to explain a little better about the future advancements and about the ongoing projects. Like, I know there are different projects on where the genetic correlations are being studied with the MRI scans, with the functional imaging, SPECT scans, and there are also few machine learning algorithms which are working to develop some neuronal circuits through deep learning, neural networkings. So how this all happen, and how this all can actually can help us to predict what is happening in brain, because we cannot open up a brain and take a tissue and can do the experiments. Yeah, of course, there are chances to get cerebrospinal fluid from lumbar puncture and taking that for the experiments, but that is not quite a feasible procedure. And for the brain tissues as well, it's not quite commonly practiced, though practiced in some special cases for glioblastomas and all those diseases. But for mental disorders, like for neuropsychiatric and neurodevelopmental disorders, I don't think there are disadvancements for taking brain tissues. So generally, people now are working on the functional imaging part and something on the genetics part. So they're trying to correlate with these things so that we can have some genetic markers. And genetic markers means what all know that we can test those genetic markers from our blood. So it is very easy to say which genetic marker can give rise to which kind of phenotype. But it is not very easy, because there are many genes for only even a single trait. So that's why the kind of machine learning algorithm, functional studies, genetics, some biochemical assays, all together are trying to predict rather to mimic a diseased brain and a healthy brain. So let's talk to this study, and let's share your views with us and with all my viewers, so that we all get to know. Yeah, this study.
Mental health is, in my perspective, is a state of well-being where the individual can realize his or her own potential and can deal with the normal daily life stresses, and also he or should work productively and fruitfully and should be able to make a substantial contribution to her or his community. And if you ask me about the mental illness, that what is mental illness, then I would like to quote Candle. Candle is a Nobel Prize winner in 2000. So according to Candle, that the mental illness are simply the brain disorder, and all variations in behavior arises from individual variation in our brain. So means if somebody is mentally unwell, then that means there is definitely some problem is going on in their brain. So that is in a very simple language. He said that mental illness is associated brain problems. How neuroscience research improve mental health treatment in early detection of people at risk for mental illness. If somehow we could do that, we could detect early at of the people at risk of for mental illness, that is that will be very useful. Now, use of neuroimaging based biomarker has the exciting potential to make mental health screening and diagnostic model more accurate. And there I'm not going in very detail, but there's like the several kind of pattern and analysis of image, like the multivariate statistics. Multivariate pattern analysis use the data on gray matter volume from MRI or the brain activity from the fMRI study and dependent variables to classify people with and without mental illness with high sensitivity and specificity. Now there is another kind of study are going on, that is identifying those who are resilient to mental illness. National Institute of Mental Health, NIMH, has why this study are going on and why they are promoting on this kind of research, because suppose in a same stress environment, somebody can cope up that environment very easily, somebody cannot. So for those who are able to cope up those environment very easily, so what is there, what the brain functioning goes on their brain, and what's the difference between the one who are resiliating and one who are not able to resiliate. So these, if we could figure out that part, so by understanding that, if that we can understand, then probably some therapeutic detail could be made which can improve the mental illness for those who are not able to cope up. So like let me give an example, like the study of the study of the neural substrate that protect people from developing a mental health condition it's a new area of investigation. Okay, now so suppose let me give an example, like explicit memory, which is the conscious retrieval of a thought release on communication between the dorsolateral prefrontal cortex and hippocampus, and is a prominent cognitive challenge for people with major depression. Now, therefore, having more and stronger neural connection from the dorsolateral prefrontal cortex to the hippocampus, underpinning effective explicit memory may be a neuroprotective factor against depression. So to summarize, the neuroimaging based biomarker of resiliency have obvious clinical utility for screening, prevention, and personalization of mental health treatment through an understanding of how the brain can protect itself. Neuro-resiliency research will aid in the identification of which neural circuit must be strengthened to prevent mental illness and promote healthy psychosocial functioning and adjustment. Now, by understanding the neurobiological mechanism of mental illness, cognitive neuroscience research has generated a significant amount of evidence indicating where to target medication, the brain stimulation, and the psychosocial intervention. So that place is very important. So that where we can identify from this kind of means resilient study, means for in a same environment, one group of people are not able to cope up, one group of people are able to cope up. So this kind of thing has come up from this neuro resilient study. Well, now another thing is another word has come up, that the personalized treatment. The personalized treatment is very important. In a very simple, all individuals are different. Probably if we can integrate all these things, means their case history, their image analysis, and their genetic profile, their imaging profile, genetic profile, and their case history, if we can combine that, and that could medically define one individual, and then the medication would be personalized in that way. So this called personalized medicine that has also been started. Now another thing is deep learning. People are applying artificial intelligences or several model. It called deep learning, means if you specifically know about the model, want to know about the model, it called multimodal deep neural network. And like that there are different kind, means not one, there is a multiple algorithm for that is existent. Those now, and these deep learning algorithm are useful in healthcare and medicine for developing a preventive personalized medicine. This time to till date, there is a multiple model has developed, and the image pattern analysis, and to emphasize the personalized medicine is going on, and is definitely a advancement of the neuroscience research for the, not, I will not say only for the treatment of mental illness, but the most importantly the diagnosis, and then to develop a preventive personalized medicine. So yes, that's all. Thank you.
While there are many of the researches going on how to distinguish frontotemporal dementia from Alzheimer's, or in the same way for the mental disorders, how to distinguish the different subclasses of the diseases, but ultimately when it is a kind of management, disease management, we come back to the same kind of drugs. Either it is let's say SSRIs, or the other ones, the benzodiazepines or those things, or for Alzheimer's it is cholinergic stimulators and all those things. So the research part is not still translated in a good way in the clinical perspectives, but we hope that it will be happening very soon. But since we are almost at the end of it, and we have actually covered a very different genre of topics, but if I just request you to say a small synopsis of what you think about mental health and what kind of awareness you want to give to the general people, so how it will be, how will you say about it? So I take the privilege to ask sir first. Being the senior most, please you start with your note to the general people about
please.
mental health awareness.
You see, the question of mental health today, even today in our society, that stigma is there, because they are always concealed by the patient and also by the relatives. This is a problem. And nowadays, of course, the patients are and the relatives are more conscious about the future perspective of the patient, future of the patient. They usually come to the doctors, but still then in the rural areas it is very difficult to isolate them and see them, and they are isolated by the societies in this way, and this results in the cycle, this vicious cycle of further depression and further deterioration and further diminution in their lifespan, because there is no treatment, there is continuous inhibition from the surrounding, resulting in depression and the way out. So this should be kept in mind by all, and management not only of the patient but also caregivers is needed. And counseling is yet another part. Counseling, the counselor should also manage the caregivers and the patient too, especially those who are depressed, especially those. And this depression, as I have said, this depression further deteriorates the neuronal structure. The more the patient is depressed, there is more enhancement of the process of this dementia, this organization. So this is the thing which we must not forget in management of mentally ill patients.
Thank you, sir. Thank you very much. And now I will come to Dr. Acharya.
Okay, most important thing that we need to take care of is that we must interact. Okay. Interaction does not need any kind of price or something. We can always interact with our friends. I may be a farmer, I may be a baker, I may be a doctor, I may be an industrialist. What we can do free of cost is interact with my near and dear ones. That's most important, because interaction can give me clues about how to overcome the current situation or the current maze in which I am. Okay. Not only that, in Bengali, there is a term that কথা বললে মনের কষ্ট কমে যায়, ঠিক আছে? So
But
it's not that simplistic, but still uh, interacting and speaking with people can help me in different ways. I can get, as I've already said, I can get cues from others to how to handle the situation. And the very important thing is that if we interact, if we can express that we are having thoughts of harming ourselves, we can be saved. That is very important. Interacting, and if I can remember 2 years ago, I think it's back in 2019, if I'm not wrong, or 2018, the WHO's theme of World Health Day, or the year, was depression, let's share. Depression, let's share. That's a very important message, that we must share what we are going through if we are in pain. And another thing which is very important is to maintain the biological functions. Okay. To maintain the sleep, to maintain, to take care of the healthy food habits, take care of my exercise, regular exercise, because regular exercise and a good sleep can prevent many physical as well as psychological illnesses. Okay. Uh, it has been a tendency, even we have seen in our student life, that to not to sleep properly and to read throughout the night, to do late night studies, with the impression that if I gobble up more, I will retain more, which is not the thing. The more we compromise our sleep, we are with the things we are trying to read will not be retained in our memories. They will not be consolidated. So that is one thing, that one important message we should give the younger generation as well as the parents, that whatever the boy or the girl is reading, let him or her sleep properly. Do not uh, read
deprived
too much at the
from
cost
sleep.
of your sleep. So, and the exercise, as you know, exercise has definite neurobiological uh, uh, ways or neurobiological methods to improve your mood and improve your general body function. So these few things, I think everyone we can follow.
Thank you so much. So we have, at the end, we are getting much more important points like
Exactly.
proper sleep, proper intake of food, and what sir has talked about, the basic acceptance of the facts. These are very important now. And I also mentioned last year what mental health means is a very abstract term. We cannot define mental health in a particular statement, and we cannot define whether we are healthy or not. But of course, if we are happy, we can have our work efficiencies, we can have a good social interaction. So at least we can think that okay, we are on the perfect track. So from today's discussion, there are many more topics that have come up. So maybe we will come again pointing out a single point from that and discussing on all over. But what I, as a conclusion, want to say to all of you, thanks for being with me. Sir, my sincere respect to you that you have given me so much time. Dr. Acharya, thank you very much. I know you have a very busy schedule with your patients and still you have managed time for me, and that is quite admirable. Thank you very much. Please study what I would say to you. Thank you very much. But at the end, I will say that what is the summary of the program is to increase awareness, that we have to be aware that mental health is something which is equally important as our physical health is. So it's not about stigmatizing what is, if a person is having problem. It's about cooperating with the person. It's about thinking in a positive way, not in a negative way. And also it needs our acceptance that at any moment we are vulnerable to any kind of shocks, be it in our physical body, be it an injury, or be it a mental health problem. So be prepared for ourselves and be prepared for others as well, that whenever we face certain things and we see others, so we have to stand by them, not to criticize them. And and also try to think rationally and try to know what are the sciences behind this kind of disorders, rather than going into some kind of story behind it. There are many stories, many rumors mongering in the world, in the social media, in everywhere. But try to believe in the science that is there behind any kind of disease and any kind of illness. So with that message, today I will conclude my program. Thank you, everyone. Be happy and be healthy always. And we are all with you. So if you have any questions, you can leave in the comment section. We will get back to you. Thank you. Good night. Bye-bye.